All right. Well, welcome everybody.
Thank you.
Thank you.
So
Hello.
before we get into the Q&A portion, first of all, for anybody in the audience that would like to ask a question, you can raise your hand in Zoom. The instructions will be in chat, and they're there now. If we could go ahead and start, I guess we could start with you, Dr. Ingels. Just to tell what you've been up to, give more of a current update on your bio and whatever you want to share about what you're doing these days.
I still have a very active clinical practice. I still have a brick and mortar practice as well as a telehealth practice, and still see again a lot of people with Lyme disease, autoimmune disease. I myself also have MS, so I work with a lot of MS patients. So it's really about helping people, find the right path through diet, lifestyle, and natural means to achieve better health.
Great. And Jennifer, go ahead.
I'm still working in the pre-ESRD space, seeing people who are trying to avoid the dialysis chair. I published the book that was just shown was the first book I wrote. I published my second book this time last year. So it's plant-fed kidneys for the patient. And the reason is because the original one was to raise awareness of actually that there is hope to treat kidney disease with with diet. But the patients read that book and said, you didn't put recipes and you didn't do this or that. And it was really written for practitioners. So I wrote the second one for patients.
They
So
always
it's
want
plant-fed kidneys for the patient.
they always want more and more and more. All right. And Dr. Lederman, how about yourself?
Yeah. So my wife, Dr. Alona Polde, and I created the sort of paradigm on chronic disease reversal, but then more importantly, how to optimize health and well-being, ultimately experiencing more joy in your lives, and how to do that. We wrote a book that talks about the 9 pillars that we believe are essential and at the foundation of experiencing more joy and optimizing your health, and then help people apply those pillars to their lives. So it's one thing to understand them cognitively, and then there's another to actually start integrating that into your behaviors and start making the changes. So we work with a lot of patients that struggle when diet alone doesn't work, or some other individual modality, because we really focus on integrating a bunch of different modalities, and we'll whether it's highly anxious, stress, panic, that type of area, or chronic pain, or gastrointestinal issues that just don't respond no matter what they do. We're getting all of the people that conventional healthcare systems find frustrating, and we find them really rewarding to work with. So we most recently coined a term, connection medicine, and that's a big piece of what we do as well, which is around teaching and helping make the case for people that how you connect with someone else affects your physical health, how you connect to what's going on inside of you, what you're feeling and eating, as well as how you communicate to other people, actually affects your immune system, cancer promoters, all sorts of different pieces of your health that need to be addressed, as well as what you eat and medicines you take and interventions you pursue. So we put it all together for people and get a really good outcome.
Great. And just people who've been watching us all day. So your wife was on just a couple of segments ago, Dr. Alana Polde, right?
Yeah,
So
Dr. Alona Polde, yeah.
Okay. How do you say your name? I'm sorry.
Alona.
Alona. All right. I
Yeah.
totally destroyed it then before. So I hope please ask for my forgiveness. So so what led you to, all right, so this is for you. So what led you to focus on the importance of authentic connection with family, friends, colleagues, spirit in the natural world, in achieving wellness, and why isn't something, given, I'm assuming that your thesis is that how important this is. How come it's been missed in traditional or conventional medicine?
I think it's something that people understand intuitively. Oh, connection's good. Sort of like when we got into the plant-based diet, a few decades ago, where people would say, yeah, diet's important, healthy diet's important, but what's it going to do? What's the real, make a little bit of a change. When you got to a whole foods plant-based diet, right? And you really made big changes in your diet, huge changes in your health occurred. Similarly, with connection, I think we're a little bit early in the curve here, but the data is coming out that how you interact with other people affects all, your autonomic nervous system, affects your immune system, affects all different parts of your body. And that has a huge impact, specifically if you really shift how you interact with your environment, how you interact with your world. And then we sort of experienced it myself, dealing with some chronic pain issues and some other health issues that didn't get better despite optimal diet, exercise, and sleep and things like that are common in the wellness world. And then I said, wow, this is pretty impressive. And then it started changing, my life for the better. And then I said, hey, we are to really help patients with this. And then also at the same time started connecting with a whole area of science and different researchers that were exploring this, but are not really getting the amplification or getting the stage to present their work as much as I think is necessary or needed. And putting that all together, it makes a lot of sense, just like, a healthy whole food plant-based diet did, 20, 30 years ago.
So it almost sounds, and I'm going to handle this somewhat conversationally. So if anyone else wants to jump in on any particular question, by all means, feel free. You guys all have different backgrounds. So if you want to jump in, that's great. I have questions that are geared, more for each of your specific expertise, but and I just want to follow up on that. So it's actually, from what I'm hearing, it kind of sounds like the same way that the medical industry looks at, symptoms and organs outside of the context of a holistic being. They're looking at individuals outside the context of community and their social fabric.
Right. And now the science is coming out. For example, if you have a doctor that interacts with the patient and it's a high empathy doctor compared to a low empathy doctor. So just how the doctor connects with the patient. If you have a high empathy doctor, they found that patients in one study had 25% better LDLs, 29% better hemoglobin A1Cs. Another study looked at acute metabolic complications when you had high empathy doctors versus low empathy doctors, and it was 41% lower odds of having acute metabolic complications. So how the doctor treated the patient affected or seemed to be correlated with the patient's health, right? And the same thing with pain, right? If you got the same painful stimulus from a doctor that you had high trust with compared to a low trust doctor, the high trust doctor had you registered less pain from the same stimulus. So it was the same stimulus, but the pain felt less, and the pain centers in the brain lit up less if you had high trust doctor. So in other words, your relationship, your sense of, ultimately it comes down to sense of safety, how much your autonomic nervous system is putting you into threat physiology affects your experience. It affects your health. It affects even, pro-inflammatory cytokines are released when you go into this threat physiology. We know that increases insulin resistance, right? So all these things are starting to connect and make sense of everything that we knew intuitively was important. But now it's essential that we include that in our healing models.
Thank you. And anyone want to add into that before I move on to the next question?
I can't remember who said it. It might be Voltaire, but I think the saying something like, the doctor's job is to amuse the patient while nature heals. And I think to a certain degree, we're alluding that, the body has this wisdom to heal. We just got to get out of the way and give it the tools to do that. So I completely agree with Dr. Lederman saying it's like your ability as a practitioner to influence someone's belief in their ability to heal, their belief in what they're doing for their treatment, I think has huge impacts. And I can remember as a young doctor seeing these doctors that would do something that worked beautifully for a patient. I would go in as a new doc and it didn't work at all. And I'm like, well, gosh, if it's the same thing, why isn't it having the same outcome? And it could very well just be the belief in an experienced doctor who had the confidence in it versus a newbie who didn't. Maybe that was the big difference. But
and I've seen videos of kids getting shots, and you can see their response be drastically different when they're being soothed and calmed and they're handled compassionately versus if a doctor just kind of grabs them, doesn't really care, and just jabs them and it says next. So you could definitely see that type of reaction, and you can imagine like the fear and the anxiety that gets built up having physiological effects on an individual. So it intuitively makes sense.
Exactly. Helping, I think one of the most important things we can do as practitioners is to help patients feel safe and to feel cared for. And if we do that, we all of a sudden shift their physiology in a way that allows their natural healing abilities to be realized. Right. I think that's, we'll have patients that will say, hey, I've had panic, I shake, multiple times a day, and I'm waking up with panic attacks. And we teach them how to experience safety. And over a period of time, then they'll say, all of a sudden, I've had a panic attack in a month. And it's a shift in their whole physiology that happens, that medication alone, or or a doctor coming in for 10 minutes and looking at the chart and not even looking at them, right? You can't heal that. You can't fix that with those type of tools or that type of interaction with patients, right? So I think it's so important that we realize this broader approach.
And what is the response from, science or medicine is considered like a hard science. And this, it's very easy for people, regardless of what the evidence suggests, especially in the medical community, to look at this something new as soft. And what kind of response are you getting back from professionals? Do they recognize, do your colleagues recognize that how they treat people is going to affect, or how they are in their own community, whether or not they are isolated and alone, will affect their health and their healing?
Right. I mean, there's definitely this bias that is soft, right? This is touchy feely. This is soft, but medicine, and that medicine is the answer, and that pills are the answer, and that a randomized controlled trial is the only thing that matters. And right. But at the same time, how's that working for you? Right. And we get all these patients that are really struggling, and people, depression, anxiety, gastrointestinal issues, chronic pain. I mean, you name it. There's so much of it, right? And to me, even if it's soft, if it makes their lives better, forget about the fact that it actually can heal and help heal. And I don't think it's one or the other, right? I think diet's important, sleep is important. Sometimes medication is actually important, right? And to me, but it's don't take some and throw out the other. Why not put it all together, right? And I think there's this idea of, oh, is it this or is it this? Well, this is soft, so this is the only thing that matters. And to me, it's everything that matters. And just because you can't measure some things as easily as others doesn't mean that they're not important.
Great. Thank you. All right, Jennifer, you've been waiting patiently. So, what is so with chronic kidney disease, how does salt intake affect its progression? And I apologize, these questions again, because of your different expertise, are going to be a little jumping from thing to thing, but so what are your recommendations on salt, and does salt type matter? And we had our last speaker was talking about celery salt, like salts, I guess, being processed through plants are somehow different than the salt that we would get in the store, regardless of what kind of salt that is.
Yeah. Well, salt is one of the first things that I speak with patients about, salt and protein, keeping protein down and salt down. But salt definitely will raise blood pressure. And also, salt is linked to kidney damage directly. So it increases proteinuria. So even without raising the blood pressure, it still can cause damage. And then, I always say that I tell my patients, if you're a kidney patient, you're a heart patient, because more than 50% of kidney patients die actually of some sort of cardiovascular issue. And so, so with salt, then you've got two guidelines. You've got the KDOQI guidelines, which say 2,300 milligrams a day or less. And then you've got the American Heart Association guidelines, which are 1,500 milligrams a day or less. I tend to go with the American Heart Association guidelines because, like I said, kidney patients are heart patients. Now with that, most of the time, most of the people that I work with, they're not dealing with celery salt. They're dealing with, fast food and salt in their food at the table. They may come out with like, well, I do this. What about this Himalayan pink salt or whatever? It's still salt. It's still going to raise blood pressure. It's still going to, damage the kidneys, especially if your kidneys are already damaged. What you're trying to do is let the kidneys rest. You don't want to drive them further. So the less work that the kidneys have to do, the better. And so I tell them to limit salt. And with that, we talk about looking across the entire day. Don't be so focused on every teeny tiny little thing. Look at your day and make sure you're staying within those guidelines. And you know what? And they can do it, but you've got to have other options too. You've got to help them learn how to season their food. And so another thing with kidney disease is inflammation. Well, dried spices have such high antioxidant values that they'll help lower inflammation. So let's kill two birds with one stone. Let's bring down the salt intake, bring up the spice intake, lower inflammation, lower blood pressure, lower proteinuria coming through those kidneys, and and stay out of that dialysis chair.
So first of all, what is proteinuria? Can you define that for the audience?
Yeah, so proteinuria, so clinical proteinuria is when you're spilling so you've got protein in different areas. You've got protein in food, you've got protein on your body, you've got protein in your blood, but you should not have protein in your urine. So, but a lot of times if you're a diabetic or have high blood pressure and you're not getting your urine checked yearly, I highly, highly recommend that you do that, because when someone's kidneys are damaged, they begin to spill protein in the urine. That's called proteinuria. One way that you can know that is if you have kidney disease and you're looking at your urine and it's very bubbly, that is an indicator that you may have protein in your urine. If you're a diabetic, same thing. But a lot of times the problem, and this hasn't gotten better over the years, is that, when I was in the dialysis centers, most of my patients came to me because they were in ER crash. And by that, I mean, they had no idea they had high blood pressure. They had no idea, or they did know that they were diabetic or had high blood pressure, but they didn't know they had kidney damage because their urine wasn't getting screened every year. So make sure your doctor screens your urine. But then they crash into the ER. They show up, they're throwing up, they've got swollen legs, and the doctor says, "I'm sorry, your kidneys have failed, and we've got to put a shunt in your neck right now because you have to go on dialysis right this very minute." And that is a very, the risk of death with that shunt in the neck is so much higher, 50% greater chance of dying within the first 90 days of dialysis. And it's just not a way to start. You don't want to start in the first place, but if you are going to start, you want a controlled start. And so anyway, that is why you need to have your protein checked. And no protein in the urine is normal, first of all. But if you're spilling greater than 3 grams, it's a pretty big deal. So you want to get that down. And here's a way to explain it. So, and a nephrologist told me this one time, and I thought it was pretty interesting that, if you have a colander and you're washing your grapes, the little holes in the colander are so small that those grapes won't come through. But if your dog chewed that colander and those holes got bigger, the grapes are coming through now, and that's not normal. So in your kidneys, you have a glomerulus, and the hole should be small enough that the protein doesn't come through. But when you damage it with high blood pressure, diabetes, genetic conditions, things like that, those holes become bigger, and then the protein comes through, and that is not normal. It's not something that you want to have. And so that's what it is.
And so you mentioned limiting protein. Is that dealing with a symptom when you need to require someone to limit their protein, or is protein actually causing kidney issues and we're eating too much protein in our diet?
Well, we are eating too much protein in our diet. Most of the time, I mean, that's not what's causing the initial kidney damage. It's usually like the main two causes are diabetes and hypertension. And then you can back up from there. Obesity is usually causing the diabetes and the hypertension. And then you've got genetic conditions like IgA nephropathy or polycystic kidney disease, lupus nephritis, things like that. There's a whole slew of genetic conditions that cause kidney damage. And so with the pre-ESRD space and a pre-dialysis patient and a dialysis patient are very different. So do not go out on the internet and start looking for diet information, because it's going to be for dialysis patients. They need high protein. They lose protein every time they sit down to that machine to get their blood clean. A pre-dialysis patient needs low protein. And the more protein you eat, if your kidneys are damaged, if you've got that damage on the glomerulus, you're going to drive more protein into the urine. So it's the opposite, because a lot of times when you begin to urinate out protein, certain blood protein indicators will start to go low. Well, that's really more inflammation. And when you eat more protein, you're going to just lose more protein, especially animal protein. So plant protein is safer, but when you're eating a lot of animal protein, you're going to have more proteinuria. And the other thing is, when people are eating a lot of animal protein, they become more toxic. And so then they get like a metallic taste in their mouth and they don't want to eat. So then they have a spontaneous reduction of food intake anyway, and then they become malnourished. So what I would say is work with a dietitian, get on plant-based proteins, lower that inflammation. If you're there's different stages of kidney disease. So if you're stage like 1, 2, 3, then you can pretty much just do a plant-based diet. Don't chase protein. Don't go be doing a bunch of protein powders and running after tofu all the time. Just do a plant-based, whole food plant-based diet, and you pretty well will be okay. If you start to get stage 4 or 5, then you need to go to a very low protein diet, and then you supplement back with something called keto analogs of amino acids that keep you from being protein malnourished, but also will help scavenge some of that protein from your diet and from endogenous protein breakdown. And then that way, again, your kidneys have to deal with less protein. Protein is the only micronutrient with nitrogen in it. Your kidneys have to filter nitrogen waste. So if you're a kidney patient, you may have seen something in your lab like blood, urea, nitrogen. That's what they're looking at. They're looking at that waste that your kidneys are not getting rid of. And so that's why we limit protein. One of the many reasons why we limit protein.
Yeah, people are so worried about protein and getting enough. And if anything, I'm more worried about getting too much. Like
right.
And I'm not even talking about kidney patients. I think in general, people are just trying to get way too much protein. They wind up hurting themselves in that effort to try and get more protein. You ask people, well, you're so scared of this protein, not getting enough protein. Have you ever seen somebody who hasn't got enough protein? What does that look like? They can't tell you, right? I have no idea. But the people that we're talking about, right? We're not talking about people that are starving to death. But this idea of I'm not going to get enough protein, they're so scared of it, but nobody knows what it even looks like. Maybe that's why it's so scary. I don't know. But it's like, let's not be scared of something and then do something reactively that winds up actually hurting us when the initial concern wasn't actually a problem. So I think that's particularly important to think about.
Well, it is funny, obviously, if there was a major epidemic of people deficient in protein, we'd probably know, most people probably know what it was called even. And they don't even know,
right,
what it's called when someone's deficient. You know what it is when it's D or C, but nobody knows.
Right, protein, right. But everybody's I got to get more. I got to get more. They don't know how much they need. They don't know. But I know I need more. I know I need more. Right. It's this.
And where does that concept that we need so much protein, and not only that, but like that protein is the nutrient that is like the cure all and end all for for all nutrients, or is like the bedrock of nutrients? I'll ask that of any of you.
Maybe the fitness industry. I mean, I think it's pretty prevalent there, but
it's the idea that
social
it's
media
to build things, I guess.
Yeah.
So Jennifer, so real quickly, what is the earliest sign? So you said most people don't even realize they have these issues. What is the earliest sign that someone might look out for that they may have like an aha moment, like, huh, maybe something's not wrong? Like you mentioned the bubbles, is that the earliest thing that they would see? Or
that's the bad thing about kidney disease, and that's why I think that so many people end up on dialysis. The problem is people aren't being screened appropriately, and there are a lot of times there are no symptoms until you're very far gone. You don't. If even at a late stage 3, sometimes you're not going to see like edema in the legs. You're not going to see anything like that, and so I think a lot of times people just don't know. And then even when they do know, so usually it's like a primary care doctor or an endocrinologist or somebody that finds it, and then they refer to the nephrologist. But then the nephrologist never refers, not never, most nephrologists in the United States do not refer to a dietitian, never mention diet at all. And that should be the bedrock of their treatment. And so that's the problem. It's a silent disease. So you likely won't know, but until you're very late stage. And then at that point, your GFRs, so in the kidney is made up of functional units called nephrons. Once a nephron dies, it never comes back. So like, the liver will regenerate. Nephrons don't regenerate. And so the let's say if you have one that dies here, now all these others are working harder. And so then another one dies. Now all these others are working harder. So the quicker you can get a handle on that and let the kidneys rest. The a lot of times, like in stage 3, I'll see there's something called glomerular filtration rate. That's how you tell what stage of disease you're in. I'll see that get better. It will go the other way. But if you're late stage, if you're stage 4 or 5, sometimes we're just holding steady. And either way, you know, fight for where you are, fight for that GFR. But you know, if you can at least hold steady, that even is better, because you know, once you're on dialysis, the dialysis machine removes waste well, but there's certain molecules that are a little bit too big for it to remove. But if you do have some residual renal function, like your kidneys are still working a little bit, that's a good thing, because they will remove those larger molecules. So the longer you can hang on to any kidney function that you have, the better. So
great, thank you. And Darin, I appreciate your patience. I'm coming to you, and I expect a good Voltaire quote.
That's the only one I got.
All right. So for people battling Lyme disease, how effective are each of these approaches? And I got a number of approaches. I won't hit you with all of them right away, but I'll give you a couple of them, and then I'll give you a few more. Antibiotics, ozone therapy, and hyperbaric oxygen chambers.
Well, you know, again, I think when you think about Lyme disease, we think about the total person, you know, they're all doing different things to the body. And there's a lot of therapies out there in the Lyme world that can be effective. And again, it varies from person to person. I think if we're talking about antimicrobial therapy specifically, you know, I mean, antibiotics, particularly if it's acute Lyme disease, can be extremely effective. For late chronic Lyme disease, you know, the research is not terribly compelling for using long-term antibiotics. And the research suggests either people get temporary benefit or they get no benefit at all. And I've seen people clinically that have been on antibiotics, and some people do well. I see a lot more people that end up having to stop because the side effects were worse than the disease. Ozone therapy, you know, we do ozone in our practice. Again, it can be effective at some places. Again, it's better for acute Lyme disease. I don't think it's terribly beneficial for chronic Lyme disease, and it's very expensive. Hyperbaric oxygen, I'm a huge fan of. It can help mitigate a lot of the symptoms of Lyme disease. It's a good anti-inflammatory, can help with circulation, can help release stem cells from your bone marrow. But as a direct antimicrobial therapy, even at high pressure, you're probably not going to get much of effect in that way. So it's a great adjunct therapy in everything else you're doing, but I wouldn't use that as a standalone antimicrobial therapy.
Thank you. Okay, next round. IV colloidal silver, stem cells, and water fasts. Oh, I mean, that's for you. I'm adding. Yeah. I'm adding to the list. I don't want. I have a whole list. I have one more round of things. Yeah. And I didn't want to give you all of them at one time. So
yeah. So IV colloidal silver. I personally use a lot of silver. It's great as a nasal spray. Great for throat infections. I've not personally used it IV for specifically Lyme disease. I know a doctor in Florida who used it very successfully. So again, it's just that the amount you have to use, the timing, I think it gets to be quite expensive for most people to do that, but it's reasonable. So what was after IV silver?
Stem cells was the next one.
Yeah, I mean, stem cells isn't a cure for Lyme disease. I think stem cells have a lot of potential in a lot of different areas. The problem with stem cells, particularly if you're doing it IV, we don't know where the stem cells are going to go. We don't know how often you need the treatment. We don't know what stem cells are going to be the best type of cells. Should you be using exosomes, mesenchymal stem cells? You know, the research is still being done. So we, you know, again, for what people end up spending on it, which ends up being thousands and thousands of dollars, I think there are a lot more cost-effective ways to approach Lyme. And I'm sorry, after stem cells?
Water fasts.
Yeah, I mean, water fasting is great. You know, most cultures around the world do fasting routinely. You know, again, it induces something called autophagy, which is your body's innate ability to start cleaning up all the old, dead, dying cells. So I think, anyone out there, despite their health status, can do at least a 24-hour water fast. If you can get up to doing even a 2 or 3 day water fast, that can be incredibly helpful. There's really very little risk. There's very few conditions where water fasting is contraindicated. Other than that, most people feel kind of grumpy for a few days and not eating, but we as humans can survive without eating for 3 days. And most people have enough body fat on them that they'll be just fine. But again, what it does metabolically, can be huge. And there's a company out there called Prolon that developed kind of an eating pattern that mimics fasting. It's a 5-day program. And the whole idea, this is Walter Longo's whole thing, is to try and induce this autophagy. And again, it'd be really, really helpful for someone dealing with chronic Lyme.
Okay. And then I get 2 more: herbs and nutritional supplements.
Well, I'm going to be biased in this because I'm a naturopathic doctor. I think herbs work incredibly well. Again, I treated over 8,000 Lyme patients in my 25-year career, and I've written maybe 10 prescriptions for antibiotics. So the beauty of herbs is that because they are chemically complex, they don't just have one ingredient like a lot of antibiotics that really kind of only target on killing the bug. With herbs, they might have constituents that kill certain microbes, but they have components that are anti-inflammatory. They promote better circulation. They can help support your immune system. So it really gives us the opportunity to mix and match for each individual person what they need specifically to address their collection of symptoms. So I like the fact that we get this broad effect, but we don't get the risk of really damaging the gut microbiome. These are plants. Our bodies know how to assimilate plants quite well. So we rarely get complaints of die-off or certainly killing your gut microbiome. We know that a lot of antibiotics can damage your mitochondria. Lyme disease itself can damage your mitochondria, and that's literally part of the cell that creates energy and facilitates cell repair. So we don't have to run the risk of harming the mitochondria with plants. And again, they're just, I think for most people, they are a safer, effective, cost-effective option over antibiotics.
And nutritional supplements?
Yeah, I mean, we use a lot of nutritional supplements. Again, I'm not in the camp of sending people out the door with 50 supplements. I think, again, we want to encourage people to eat good food. We want to do as much of this through diet and just general nutrition. But there are certain things that a nutritional supplement can help where it may not be possible to get the amount that we want through diet alone. We're using it almost as a drug at that point. But some nutritional supplements can help improve mitochondrial function. We use things like coenzyme Q10, acetyl L-carnitine, vitamin B6, magnesium. We can use these nutrients for very specific things where we feel either maybe they're not getting enough in their diet, or maybe we want to give doses higher than you would get through the diet that have this physiological effect that can start to get people functioning better.
Okay. So Matthew, so basically, can you discuss your patient experience as you go down this road? Like, how many people are you seeing and using this whole holistic modality with connection and all the other pillars that you discuss? And how has that changed their outcomes? Have you seen significant changes in their outcomes?
Yeah, so I see patients or clients for between an hour to an hour and a half, if it's a couple or families. So I have a small panel, right? There's only so many of those I can do in a day, but seeing really dramatic changes as we bring all of this together for them. And what's really exciting is that they get hope again, right? They learn over time. There's a lot of education around how this affects their bodies, why we're doing it. At first, they're like, I'll just say, hey, I need you to trust me on this. But over time, they start to understand through education why this works. And it's really rewarding, right? Because like we talked about earlier, you set the stage for the body to do the healing. But a lot of people aren't healing, not because there's something wrong with their body, because there's a piece missing in sort of that stage setting, right? So, sort of like what people think, oh, we heal broken bones. We line the bones up and then the body heals them. So we have to align a bunch of things in their lives, and it takes a little time to do that, but then their bodies start to heal. So, whether it's, like I said, it can be chronic pain, all different types of chronic pain. It can be all sorts of gastrointestinal issues, fatigue, headaches. It can be all the different levels, the continuum of anxiety and panic and stress. And then there's also the piece, I'm one of the few medical doctors that's also a certified nonviolent communication trainer. That was a 4-year training process for me. Actually harder than medical school if I had to.
What
really
was the training called?
It was nonviolent communication as a CNBC certified trainer of nonviolent communication, which teaches people how to communicate and connect, and super powerful. And anyway, this is, just another piece of the puzzle, that when the way people are interacting and suppressing, and sort of this state of artificial harmony that a lot of people are living in their lives, whether it's work or at home, it contributes to that sense of sort of being in that survival mode, that threat physiology that's going to run the systems amok, right? It's going to cause all sorts of problems. So again, there's different tools that we bring in that help to lead to these outcomes. Does that make sense?
It does. And do you think that it is this, like, with having connection and compassion and empathy, all those things are de-stressors, right? It is, based on what you're seeing, is the pathophysiology related to all the stress hormones that we experience when we're isolated and alone? We don't have support. We're trying to navigate a world, and we're pretending to be something in order to keep that harmony. Right. Is that what's making it stick?
No, I don't want to reduce it to something like a stress hormone. There's so many different mechanisms that are going on at the mitochondrial level, at the cytokine level, at the hormone level, at the blood flow level, at the autonomic nervous system level. It's this symphony that's sort of interpreting what's going on inside of you as well as what's going on around you, and it's trying to prepare you to do what you need to do, which is either fight threat or to sort of grow and restore and reproduce. And depending on what's going on, it's going to shift physiology, and everything we do affects that, right? So the food we put in our mouths is going to affect how the body responds, right? So if you put processed foods, they're going to affect the mitochondria. They're going to affect the pro-inflammatory cytokines. They're going to affect even blood, right? So all of that is happening. And what we have to do, it's almost, we're learning bits and pieces of it. But if anybody says, I know the answer, here's what's going on, I think at that point, red flags go up. What we do know is that if you put these pieces, what we talked about with the 9 pillars, but if you put those pieces into place, you're going to increase the chances that your body, like those bones, are going to align, and the healing is going to be able to happen. But if I said, hey, I know exactly what's going on, and I know exactly why you're healing, and it's this hormone or it's that cytokine, that's a problem. And that's what we're trying to do with conventional medicine, is say, oh, if you give them this pill, it's going to block this reaction, and that's going to fix all their problems. And I'm not saying it doesn't help in some cases when you weigh the risks and benefits, but there's no medication that's going to fix all of people's problems. And that's what they know intuitively. And even when they're on these bag of pills or doing the next fad diet, they still feel awful. That's why they're coming and looking for more help. If everything was great, they would stop going, looking for more advice and more help.
It actually sounds very similar to what T. Colin Campbell often talks about with regard to not reducing things down to their constituent parts and recognizing that there is this dynamic within the whole that can't be broken down and understood by looking at its parts. Exactly.
I love Colin's approach. Sometimes what I even the way we approach diet, it's almost too simple for people. Like, I like to, it's hard enough to try and do all the stuff that we tell you to, right? So where I can make it simple, I want to make it simple, right? So people, it's got to be this food is okay, and that food, if you eat a green apple, that's healthy, but a red apple is bad, and it can't be that. We got to simplify it. People ask me, for example, we were talking about salt earlier. They're like, "What's the healthiest salt?" What I said, what's the most expensive salt? I said, that's the healthiest because you're going to use the least amount of it, right? Like, to me, That's how simple it is. Right. So, but is salt good or bad? Well, if a little bit of salt's going to get you to eat these foods, then a little bit of salt's probably good for you. But if you don't need it, then don't use it. Right. That's too simple for people.
Mm-hmm.
Right. So that's the challenge. Hey, what's hard is the nonviolent communication, right? And how to all of a sudden think and talk differently to people and see the world differently. So if you're going to make something hard, that's hard. So dive into that. And, the stuff where it can be easy and simple, accept that it's easy and simple. Right. And then the other thing I try to do is remove the noise. There's so much noise that's confusing the heck out of people. Right. We gotta try and decrease the noise and help them focus and then jump on board.
Thank you. I think it looks like Jennifer may have a new salt recommendation when people ask her about salt.
Yeah, I love that. That's awesome. Yeah, and
So-
I mean, I think, I don't know. I would love to know with everything that you're talking about, like with even someone that's further along in chronic disease, because when you're talking, I'm thinking about, almost moving down tertiary prevention where, somebody's already on dialysis, and then, their mindset that it's so hard and working with their mindset because they get very depressed. But
Right.
I'll tell you one thing that really is, we push home therapies for someone to do dialysis at home, which if I was on dialysis, I would do dialysis at home. But sometimes people don't want to do that. And they'll tell you this, they'll say, but when I go to dialysis, I see other people like me. And they will talk in the lobby and they will, because, in a dialysis center, it's like chair, 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 chair. It's open, they're seeing each other and it becomes family to them. And
Exactly.
so, in a sense, sometimes people, even though science tells us that they're going to do better doing a home therapy, but they're mentally better going into the center sometimes. Not always,
Right.
but
Right. But that connection, they naturally are drawn to that connection. Right. And that their body, and that's what I'm saying. There's a lot of wisdom in our bodies. And if we stop and listen to it, right, all of a sudden it can take us in some really healing directions. And I think what you pointed out is really powerful.
Mm-hmm.
Now, and I tell people, I also, when people get depressed and say, "Oh my God, I have end stage cancer," I think I empathize with everybody, and at the same time, I tell everybody, I don't care what you look like. I tell everybody you have cancer. Everybody's got kidney disease. Everybody's got heart disease, right? Everybody's got some insulin resistance. But where are you on the continuum? Right now, my body is trying to fight all sorts of mutations, right? That are going on every day. It's trying, the immune system, our natural cancer fighters, trying to help. There's the environmental toxic burden that we're trying to navigate, and it's trying to keep me sort of above water. Same thing, I got some kidney damage just from the years of being alive. So, I got some heart disease. We know that kids, very young have fatty streaks on their blood vessels, right? So think of it as we all have all these diseases and our body is trying to heal them all. So why not do the diet, the cardioprotective diet or the renal protective diet, which happens to be a healthy, whole foods, plant-based diet, right? So that diet is, to me, that's the answer. To go on if you have cancer, they tell you, mainstream associations will say eat more fruits, vegetables, and whole grains. That's a great diet for people that have had cancer. That's what they say. Well, great, of course. So eat that diet before you have cancer. The same diet that helps you after you get diagnosed is the diet that I would be on before. The same thing that diet helps you after you get kidney disease. Why not try that before you get diagnosed? Because when you get kidney disease is what you really mean is when you're diagnosed, when you got bad enough that you're diagnosed. When you got diabetes is when your insulin resistance got bad enough and you spilled enough blood sugar, glucose in your blood that we could pick it up with our tests. When do you have cancer? On average, it's 10 years old before we can pick it up and it's 1 centimeter big on the scans. But it's been growing for 10 years. So that's not when you had cancer. You actually had cancer on average 10 years before we could diagnose it. So start treating yourself like you have all these diseases, not to depress you, but to give you a little fire under your butt to start making these changes. I don't know if that resonates. I
that resonates. I love that.
It totally resonates. And to kind of go further down that road, the idea that we give our children all these foods and we say, oh, they can eat it because they're young. And basically we're setting them up for the diseases, which become the reason why you can't eat it when you're older and you feel so terrible. And it's like, well, it's really, it's crazy. So I was going to ask both Darin and Jennifer this question, which is, have you noticed any correlation between someone's their support, their you know, if someone has nothing in their life. I'm sure both of you guys have encountered somebody as a patient that you know, is isolated, is alone, that does not have a support system, versus somebody whose family comes with them and, you know, they have tons of support, they have a social life. And have you noticed in your patient population any sort of difference that ever stood out to you as to how those social aspects, those more human outside of the body aspects, affect the success of any particular treatments?
You want to go first or you want me to?
Please go ahead, Jennifer.
Okay. So yes, I mean, for sure, in again, in the whole spectrum. So you know, one thing that's really interesting with nutrition is that if the family member will join, say a spouse, if the spouse will join the spouse in eating the healthier plant-based diet, they're so much more effective and they do so much better. I mean, it is just a big deal how much better. And if you think about, you know, I always tell my children, you know, the 5 people you're around, that's who you become. So pick your friends wisely. And the same is true with your health. The 5 people you're around is who you become. And so and I know that it's harder, I think, for someone like me. We were, Darin and I were talking about this before. I'm from Mississippi, which is the most unhealthy state in the nation. So, and I don't have what they have out in California. You know, we got to improvise down here. We got to, you know, do things at home because you're not going to get it if you go out. And people around you aren't going to eat like you. So when I'm working with people, I say, you are not alone. There are people like you. They may not be, if it's say I'm working with someone in the South, they may not be right here, but they're there. And so even just having a peer or someone with you, there's peer counselors for people with kidney disease because a peer understands where you are. So I definitely see that. And then I think I have a man in mind he was on dialysis and he was isolated. And he said to me, the only reason I am still sitting here is I want to see my daughter graduate high school and then I'm done. I don't care. Like he didn't want to talk to me. He was like, I'm not going to change anything about my life. I'm just hanging on because he didn't have anything to live for. So helping people find connection. And I don't know, Matthew, if this is along the lines of what you do, but I will tell like people, when you're out exercising, I want you to smile and I want you to just say out loud, I am thankful. Say something you're thankful for that has to do with exercise. I am thankful I have legs. There's someone paralyzed right now that cannot walk, but I can, and I'm thankful. And so I tell them, I am thankful that I get to eat these healthy foods. There are people who live in food deserts who the only place they can buy food is at the local gas station, but I can go to the grocery store and buy food. So I'm thankful for that. So I tell them to say there's something they're thankful for, specific, not just like I'm thankful for healthy food. It has to be specific because I think that changes the way that they look at what they're doing. Having support changes the way that they look at what they're doing. And then having 5 people around you that are healthy, if you can. If you live in the South, call me. I'll support you, but because there's not a lot of us down here, we're kind of alone. But yeah, I think it's a huge deal.
Yeah, I would agree. I mean, in my patient population, who are mostly chronically ill people, you know, that sense of isolation is a very real problem. And I think so many people feel like they're the only ones dealing with whatever's going on. And at some point they feel like they're burdening their friends and their family and, you know, talking about the illness. And so they don't want to talk about it. They don't want it. And depending again where you are in the world, you know, if you don't have that group of family or friends, and the gaslighting problem is a very real problem from even close people, that they don't really believe that you're sick. You know, you look fine. Having an invisible illness is a kind of a terrible place to be because on the outside, you know, people don't see anything wrong. There's no tumor growing out of your head. So they can't quite understand why you can't do the things that they do and why you can't eat the things that they eat. And as the patient, they feel bad about that. I mean, I'm just thinking about one patient I've been working with who's in Europe. She's completely cut off from her family for various, previous, issues from her childhood. She lives with a partner who doesn't really believe she's sick and thinks she's crazy. And she can't get any help from where she is from the medical community. And she feels completely alone. And, the sad part about that is out of that comes desperation. And then you start clinging to people who are often not the best source. And in the effort to want to find community, there's that you reach out to the wrong people who often make the situation worse. I mean, I'll speak about the Lyme community because I work so much. And I realized, there's a lot of like Facebook groups and these social media groups with Lyme patients. And I get it, that sense of wanting to connect. But the vitriol and the nastiness that comes from other Lyme patients against you. I had a patient who recovered from Lyme, went on to a Facebook page just to kind of give people hope, like, hey, I spent a year or two dealing with my health. I did this, and I feel so much better. And she got more nasty comments than comments of, hey, that's great. I'm so proud of you. That's wonderful. It's like, well, aren't you lucky? Well, gosh, you must have a lot of money. I mean, it was just that kind of stuff. So, it's complicated, and how we as practitioners can help our patients find that sense of community. I personally find it very challenging, but I think it's essential, because definitely my patients who are more isolated, they are not doing as well. They're struggling mentally, physically, emotionally, spiritually, and it's really challenging.
So Matthew, you spoke about studying nonviolent communication, and it was even harder, you said, than medical school. What would you suggest in these groups? And even in the plant-based world, I've constantly watched organizations implode because of inner organizational factions or dynamics, and they destroy each other. This infighting. Right? What is that education that into nonviolent communication suggest in creating support networks within, I mean, like a Lyme group? I mean, it's called a support group. I think the very foundational principle should be supporting one another, right? And yet they constantly fail. And any organization that is mission oriented is constantly struggling with this infighting. How do we avoid that based on the communication skills that you learned?
Right. Well, how you show up has ripple effects. So how you respond, how you go through, even how you think about the person that just said what they did, right, will affect the outcome. And I think, hurt people, right? Have you heard of that saying? So when somebody is lashing out is when they're usually in the most pain, but they talk in a way and think in a way that makes them least likely to get the empathy that would heal their pain. Right? So the question is, can we translate whatever messages are sent towards us and start to shift that? And that's a practice. It's not you're either born with that skill or not. You can actually learn that skill. I know because I did. Right. So people in general, when they show up in a way that doesn't seem to be like they're caring about your needs as much as they're caring about their needs, right? Or they lose connection with the humanity behind the screen, right, that they're communicating to. That's an education problem. That's a socialization problem. So there's nothing wrong with that person, but they've been educated in a way or socialized in a way where they are prioritizing their needs or disconnected from the impact of their actions on other people. So once you start to shift your framework, then you can start to respond differently to people. And I think that's where your power is. Rather than trying to control how someone else reacts, focus on controlling how you react to however they react. Right? And if we can start focusing on that, that's when the change starts to happen. And also catching ourselves, right? So if I am saying on one hand, boy, this world is so polarized, but then on the other hand, I'm hating Trump or Biden, right? Pick your person, right? I'm contributing to the problem versus trying to heal the problem. So I have to also hold myself accountable to how I show up. And I would say sometimes I'm able to do that really well. Other times I'm not. And then I go back and I repair when I'm not. So that to me is the discipline, is Start with yourself, and then how do you show up no matter how anybody else shows up? Don't let other people choose your emotional state, right? And try and be in choice in your reaction versus that sort of threat physiology where you're just reactive, that sort of primitive brain reactivity state. That's the goal. And then there's some skills and practices that make that a little bit easier.
So in the example that Darin laid out, where someone went to a support group thinking they would get support and made a very, I would hope it was a benign statement. I don't know how they phrased it, but they said, "Hey, I did this and I feel better." And then the other person came back, "Well, good for you. You must be rich," and came back with nastiness. Do you respond to that person, and do you ignore them, or if you should respond, what would be an example or model that you can give us on how to respond?
Yeah, it depends, right? I would first, regardless, I would you start with yourself, what's going on in your heart, and then if you have space and energy, you check in with what's going on in their heart. So I would first say, "Woof, I just felt the impact. Ouch." And I would take a breath and say, wow, when I hear that or read that, I feel this tension in my body. And I feel really, at first, I feel angry and defensive. But then underneath that anger and defensiveness is just feeling hurt and a little bit sad. I just want people to be caring and care about me. And when they don't, I feel really, really hurt and sad, even a little bit lonely. And then as you see, I'm doing this self-connection and I'm just checking in with myself. And through that, all of a sudden, my body, the tension starts to go down. I'm actually getting that physiological shift that I was telling you about before, from threat to protect or attack. Now I'm starting to feel safe again. So there's actually shifts in my body physiologically. And then once that happens, I can say, am I in a space where I want to be curious what's going on with the other person? I'm not going to listen to what's coming out of their mouth. I'm going to try and connect to what's going on in their heart. What's going on in their heart? Oh, well, maybe it sounds like they're really frustrated. They're probably hurting. They're probably overwhelmed. They're probably exhausted. Maybe they're broke because they've been spending all this money on treatments, or they want treatments they can't afford. Wow, I get it. I get what's going on for them. They must be really, really struggling right now. Right? And I really wish they would express their struggle in a way that was a little more kind and compassionate to me and met more needs there. But I get what's going on for them. I don't really like it. They're still accountable for how they're talking. But in their heart, I'm guessing this is what's going on. And I may not, and people say, well, how do you know? You don't know what's going on in their heart. I said, I don't know. But I do know when I guess that this is what's going on in their heart, my life is better as a result. So you don't even have to do it for them. Do it for you. You shift from this threat physiology to this compassion and care. And that is better for your own health, let alone better for them in the world. Does that help clear that up a little bit more?
Sure. No, absolutely. Darin, how you mentioned the perception of Lyme disease, you're not walking around with a tumor or something that is obvious that you're sick. So it's hard for people to comprehend. Two questions. How has the perception of Lyme disease changed over, the last 20 or 30 years? I mean, 30 years ago, I don't think anyone even knew what it was in the general population. Now people at least know what it is. And then the second question is, what are the symptoms that people should be looking out for? Because people get bit by a tick, it falls off. They don't even realize that they were ever bit by a tick. And they're not going to the doctor if they're feeling fine. And then all of a sudden they get a symptom. What would those symptoms be?
Well, the perception's definitely changed. I mean, we've learned a lot really in the 40 plus years that we first discovered Lyme disease. And I think more practitioners are aware of it. Therefore, they're doing, more testing, better evaluation, trying to help people just get that diagnosis. Lyme disease has over 100 different symptoms associated with it, so it gets misdiagnosed very commonly. But the red flags for me is when you get a combination of neurological symptoms and arthritic symptoms. Any kind of, brain fog, joint pain, neuropathy, headaches, migraines, fatigue. When you start hearing about all these things, and again, usually the story is I've been to multiple doctors, multiple specialists, I've had MRI, CT scans, all my tests keep coming back looking normal. That kind of scenario would be a big red flag to investigate Lyme or some other tick-borne illness.
Great. Thank you very much. So Jennifer, with regard to a plant-based diet as part of your protocol when you're dealing with patients, is the expectation that the plant-based diet may reverse the kidney damage, or is the kidney damage done and the plant-based diet is to mitigate or slow the progression, and is it for symptom management?
It depends on where the patient is. So, I don't know that we're necessarily reversing the damage. May be there. It is there. But as I was saying before, if someone comes to me and if I catch someone at stage 3 or better, usually what we see is when they change to a plant-based diet, and it's the plant-based proteins. A plant-based diet is more alkaline, so there's something called potential renal acid load of foods, and so that's something we really look at with kidney disease. We try to keep that potential renal acid load down. So it's not with the food is like outside the body, but when you take it in the body, what is the acid load? So you're looking at that. You're looking at the inflammation, all those things encompasses that the plant-based diet takes care of that, which, as Matthew was saying, you want to do anyway, you know. And so so if they're stage 3 or better, then that GFR, we usually see it go up. Like I was just working with a lady, and I mean her GFR increased like 10 points within a matter of like 6 weeks just by changing her diet. There was a guy, and it's all different. It's all different etiologies too of why the person has it. So like hers was a another autoimmune IgA nephropathy. This was a college kid. I mean, his creatinine decreased from like 4.5 to 3 in only 2 months. And then with diabetes and high blood pressure, I mean, those you always see this big improvement in GFR. With that, yes, you also then will see the symptoms improve. But when you get later stage, the damage is so far gone at that point. Sometimes that GFR still get up a little bit, like, and I'm talking about if it's like a GFR of like 15. So a normal GFR is greater than 90. So if we're down at like 15, typically doctors want to start dialysis if they're a diabetic at 15 and if they're non-diabetic at 10. If we're down that low, though, I mean, people have stayed at those levels for years and not gone on dialysis. And there was a study, especially like if you think about elderly people. So a lot of kidney disease is in older people. There was a study by Brunori and colleagues that put patients either on a very low protein plant-based diet or they started dialysis. And after a year, there was no difference in mortality rates. So, it's kind of both. I mean, sometimes you're just holding them steady. Sometimes the GFR is getting better, but you're always improving symptoms. So, and once they get really far gone, really they should be working with a renal dietitian regardless, but especially in those late stages of chronic kidney disease, a renal plant-based dietitian, somebody that actually understands how to look at their labs and everything, how to work with those keto analogs, because if they are very late stage, then we have to drop the protein so low that if you didn't supplement back with those, the person would become malnourished. But they also help slow progression by scavenging proteins from when you have protein breakdown, endogenous protein breakdown. Those are nitrogen-free amino acids. So what they do is they scavenge the nitrogen from other protein breakdown and build an amino acid. So not only do they improve nutrition status, but they also lessen the nitrogenous load on the kidneys. We couldn't even get these in America. When I first started this in 2012, I'd been in dialysis all those years. I started seeing pre-dialysis people in 2012. You can't even get keto analogs in America. They were only in Europe. And I would try to get them, but I mean, it was to get them sent over here was terribly expensive, but now they are available. And so it's amazing that we can actually, use those and treat people. And even if they don't get better, if we keep them out of the dialysis chair, even for a year or even long enough to just get a transplant. I had a patient message me the other day and said, I just wanted to let you know I got a transplant, and so, just celebrating with patients in that way, just being able to hold them off long enough to keep them out of that chair, is a good thing.
So we got about 3 minutes left, and one of the participants messaged me about gout, and they don't drink they eat plant-based, and they still get bouts of gout. What is your suggestion on what maybe this is for you, Jennifer, that what may be causing that gout. I mean, with, I guess it's a buildup of uric acid, if I'm correct. Why, without the typical triggers for high uric acid, what might be doing that?
Well, I mean, if they've got it goes hand in hand with kidney disease. So I don't know if they're a kidney patient, but if they're later stage kidney disease, the kidneys may not be getting that uric acid. Maybe it may not be filtering out that. They could try tart cherry juice. And then sometimes there's the crystals are so set in that they do need, there is a certain medication that can actually dissolve those crystals. It's an injection, like I think it's an infusion. So they may just need to do something like that just to dissolve the crystals they may already have.
What's that medication called?
It's called Cristexa. So that is available as well.
All right, great. And all right, so we have 2 minutes left. So I'm going to throw it out to each of you. Any final thoughts you'd like to share with the audience? If you can keep it down to like 30 or so seconds. Matthew, I'll start with you.
I hope that people really see the value, even though it's quote unquote a softer science, the value of connection, and really take that to heart. And there's ways to really improve that. And hopefully that will increase hope and a sense of agency that you can do something starting right now if you wanted to.
Great. Jennifer?
Thank you.
Thank you.
I just saw a question come through about something. They said, what can you only get in Europe? You used to could only get keto analogs in Europe. Now you can get them in America. So I would say if you have chronic kidney disease, if your kidneys are damaged, there is hope for you. If you have been told there's nothing you can do, that's a lie. There's plenty that you can do. And I hope that you will go after it with everything you have, and get on a healthy plant-based diet, find a renal dietitian that can help you. And then, like Matthew said, have hope, have joy, live your life. You're not a kidney patient, you're a person and you happen to have kidney disease. So live your life, find connections, and there's hope for you.
Great. And Darin, final thoughts?
Yeah, I would just encourage everyone tuning in to be your own best health advocate, fight for your health. And again, don't feel like you have to get into these really high tech, very expensive therapies. This idea that the more expensive it is, the better it is, often is not true. Again, go for that low hanging fruit, go for the basics. Start with, diet, nutrition, good sleep, moving your body. These very basic things that are often free or relatively easy can just have a profound effect on your health.
Great. Well, thank you everybody for all the information that you shared. It was an absolute pleasure. If we can unmute the audience, please.
Michael,
Yeah,
one thing
really appreciate it.
Thank you.
Blessings,
everyone.
Blessings.
As always.
But I understand that